Dear friends, welcome back to Ophthalmology for Undergraduates and Postgraduate Beginners. Today I am going to talk about heliophobia. What is this heliophobia? We all know by different terms. Heliophobia can be otherwise called as HEMERALOPIA. In simple term, it can be said as day blindness. What is this day blindness? Daytime vision is not that much good compared to the vision in the night. A person having a day blindness will have photo aversion. He will have a dislike for looking at the light. It is not same as photophobia. The differential diagnosis for photo aversion is photophobia. Photophobia is fear for light. Photo aversion is dislike for light. Photophobia is present in inflammatory conditions of the eye like keratitis, iridocyclitis, inflammatory glaucomas. Now let us see the details about day blindness. Now let us learn why a person develops a day blindness. Already we have seen the anatomy of the retina. In that we have told that the central portion of the retina is called as the macula. This macula is having cones as photoreceptors. It does not have any rods. Peripheral to the macula, the retina is having rods as photoreceptors. Whenever the light passing into the eye, particularly the light rays in the center, they pass through the structures of the eyes and they fall exactly in the macula. The lights coming from the angle or from the periphery, they do not fall on the macula. The light rays which are passing in the straight direction to fall on the macula, if they are obstructed by any means so that they do not reach the macula, or the light rays are reaching the macula but the macula is not functioning, then a patient or a person will develop blindness during the day. The daytime vision will be less compared to the vision in the night time. Now let us see what are all the conditions where the day blindness will develop. The day blindness will develop when there is a central corneal opacity. If you have a central corneal opacity, the straight rays that are going to fall on the macula will be obstructed. So the macula will not be stimulated. The macula is having cones, which is essential for photovision or photopic vision, the vision caused by bright light. So that is going to be affected, leading to day blindness. A patient having a central cataract in the center of the lens. The cataract in the center of the lens are nuclear cataract, cupliform cataract, thick after cataract, posterior capsular opacification. All these conditions will block the light rays going and falling on the macula, leading to day blindness. A patient is having a macular problem, primary macular problem like cystoid macular edema seen in inflammatory conditions of the eye after a cataract surgery, clinically significant macular edema seen in diabetes mellitus, central serous retinopathy that is affecting the fovea, age-related macular degeneration, degenerative conditions caused by decreased antioxidants in the body due to unhygienic food habits leading to macular degenerations, macular dystrophies caused by many conditions, best vitelliform dystrophy. You have the Cohen syndrome with macular and retinal dystrophies, cone dystrophies, cone rod dystrophies. So many conditions are there. The macula develops a dystrophy. It is a genetic disease. In these conditions, you may develop day blindness. Apart from that, day blindness can also be seen in Addis people. What is this Addis people? The pupil will not properly react to the light. So what will happen? The pupil remains larger. That is, there is a mydriasis. The light rays, they are entering in a large number. They are not getting concentrated on the macula alone. They fall everywhere, leading to less vision in the daytime. Aniridia, absence of iris. Once again, this is same like Addis pupil. Here also, light rays enter into the eye through the entire open area, absence of iris. So that will decrease the daytime vision compared to the nighttime vision. Albinism, that is absence of pigments in the iris. The iris is transparent, allowing light to pass even through the iris and falling everywhere, affecting the daytime vision when it is very bright. Toxic amblyophias. The optic nerve is getting damaged by alcohol, smoking, all those things. Also affects the papulomacular bundle connecting the optic disc and the macula. So the macula function is affected. So that will lead to day blindness. So these are all some of the conditions. Apart from that, you can have day blindness in post-chiasmatic brain injuries. You can see in anti-epileptic drugs usage. So many conditions can lead to day blindness. The simple thing we should understand is either the light falling on the macula is obstructed or the macula itself is at fault. The cones are affected. So the daytime vision is not good compared to the nighttime vision. With this, I will stop today. We will discuss about some other topic next video. Thank you.